everyone. This is Dr. Echols again. So glad to be back with you. I know it's been a little while. We've been real busy and also just took a little break. Went up to Colorado this last few weeks, had a great time, but it's always nice to be back because I miss my patients, and I'm always happy to be back and share this with you as well. Today we're very lucky. We've got Miss Melissa with us, and she is an awesome massage therapist, and she's also on this channel, so please be sure to check out some of her videos. And we're going to be working with her in just a few minutes. But before we get started with that, I wanted just to say thank you so much for the overwhelming support and response that we've gotten from people who've watched our videos, who've emailed me and called me, and even made the trip to Austin, Texas to come and see us. I'm really sorry for all of those people who are, out of the country or at least out of state who have been trying to get to see me, but, pressing matters have kept them from coming. Oftentimes people will email me and they'll say, Dr. Echols, do you know of anybody in my area that does what you do so that you can send, so that I can go there and get some help? And unfortunately, I don't really know a lot of doctors who do what I do, outside of my area. So I'm afraid that I'm not often able to help you with that. My suggestion is, though, the kind of technique that I'm using is called Applied Kinesiology. And if you will just Google that term in your area, you may get a list of doctors who practice something very similar to what I'm doing, and you may be able to get some help that way. Of course, we get people from all over the world that come from seeing our videos to our clinic, and we really roll out the red carpet for them, and we like to help them and see how much gains and, get them pain-free as much as we can before they have to go back to home. So it's always an honor to have people travel and come see us. So I hope that clears that up. One more bit of little housekeeping. I do consultations over the phone for people who just really want to get some idea about what it is they should do or what should they do this. There is a nominal fee for it. However, if you'll call my office, the number will be on your screen. I'll be happy to set some time up so that we can go over that, all of your stuff together. Okay. Is there any reason why we shouldn't get started?
Nope.
All right. Well, let's do it. I was talking with Melissa earlier, and occasionally she gets some lower back pain. And some of the things I would normally ask her is, first of all, how long has that been going on, Melissa?
Since junior high.
Really? Mm-hmm. And do you have any idea why it started? Did you have an accident, or did it just start?
I would say like stress.
Stress. I get that one a lot. Stress. What kind of stress?
It's hard to be a 13-year-old girl.
Yes, I guess you're right. Just being a teenager is stressful enough. Okay. But you weren't in any kind of accidents or illness?
There was no trauma.
No trauma or anything like that. Okay. So, you're...
Well, I did have some surgeries on my abdomen in high school.
Okay.
So there's some scar tissue on my
That's
front.
definitely stressful.
Okay.
Yeah. Okay. So we've got some lower back pain that's been going on since she was just a teenager. All right. And has this been something that's just been happening occasionally, or is it pretty much with you a lot?
If I don't do my yoga, it's with me pretty much constantly. If I do my yoga, it will go away.
Ah, excellent.
So, if I just align, strengthen.
Excellent. So about how often would you say that you get troubled with this problem?
Once or twice a month.
Once or twice a month.
Bothersome.
So the yoga seems to be kind of maybe keeping it at bay, but it's not fixing it. It's not fixing the problem. Would you agree with that? Or no? It keeps coming back.
To the point where if I have a strong enough practice, it pretty much will go away.
But you just can't practice enough to keep it away. Consistently. I'm with you. Okay. All right.
So for effective, yeah.
Okay, I got you. So what we'll do is we'll put Miss Melissa through a little bit of an examination, figure out what the problem is, and then we'll do a little bit of gentle treatment with her today to see if we can't get her some relief, okay? Now, do you have any pain that comes down into your legs or into your feet?
Yeah, been getting more, kind of like a cramp right here, on like just right there.
Okay, she's pointing to her right foot. That's good. All right, so a little cramping there.
Yeah.
Does any of the pain seem to be in the leg, or is it just cramping in the foot?
It's just cramping in the foot.
Okay, is that new?
over the last year or so, yeah.
Okay, interesting.
So
And that could be a whole host of things. It could be a nerve issue. It could be something else. But we'll see if what we do seems to help with that. So now that we know that we don't have a lot of trauma here, we're not going to be taking any x-rays of her today. We'll just get her on the table and we'll see what we can find out. So I'm going to have you go ahead and lay back down with your head here.
okay.
Just be comfortable however you are. Now, there's a couple of things that we want to do first. We want to kind of rule out that she's got a real hot herniated disc. Most people know what that is, but in between the vertebra is a little kind of cartilage jelly donut thing. It's kind of hard on the outside, but it's got some jelly-like stuff on the inside. And sometimes if the spine has been out of alignment or if there's some kind of trauma there, it can cause that jelly to bulge back and it can hit those nerves and it can cause problems like, you know, cramping in the feet or numbness especially, or pain down into the legs. That's not really going on with her, but yet to show you what we would do to find out if that was an issue, we do what we call a straight leg raise. Melissa, I'm just going to raise this up. Let me know if you have any lower back pain here. And so she's completely free. But let's say that when I got to right there, she goes, yow, that hurts. Okay, so that would tell me that the nerve coming out of her back, when I lift up her leg, it's being tethered, you see, a little bit. So that would mean, hey, this lady may have a herniated disc in her back. Oftentimes, we could lower the leg down to where it's not hurting, and then we could take her big toe and just pull it back like that. And if it hurts again, that tells us the specific nerve root that's, in this case, would be bothering her. But she doesn't have that, and we'll just be thorough, and we'll just check the other one. Melissa, is there any problem there? She's a very flexible massage therapist. That's very good. She's not having any problems there. Now, one of the major, and she was talking about her core and how important it is for her to keep that strong. One of the major muscles in the lower back area is called the psoas muscle. It's spelled Psoas if you want to look it up. And the psoas muscle is very big, and it hooks into the lower portion of the spine, comes through the pelvis, and it hooks onto this big bone here, the femur. Now this muscle, we see it go out a lot, and this is responsible for people having a lot of really serious lower back pain. Sometimes you'll see, if both psoas muscles are contracted, you'll see people come into the office bent over like this. And they'll be like, oh my God, I can't really walk. It really is painful. As a matter of fact, I had this happen to me one time so badly. 4th of July is my birthday, and I was coming home from the lake. I had my jet skis on the trailer. I went to bend over to pull the jet skis off, and it locked up in my back. I went to the ground, and I was in bed for a week. And the only time I got up out of bed, which was very painful, was to go to the bathroom or go to my chiropractor, and that was about it. So these can be very, very, very painful. The psoas muscle. And the way we test that is we're going to have you, Melissa, put your leg up like this, and you're going to push straight up this way, push up. And I'm pushing, push up again. Let's try that again. Okay. It seems a little bit weak. Keep that knee straight. Okay. Push up this way. And it is. Actually, her psoas is a little bit weak. And when your psoas muscle's weak, that's part of your core. That's not going to be beneficial for having lower back stability. I'm going to swing around here to the other side and just check this other one here. Now push up real hard for me. Now see that one? You feel the difference. Mm-hmm. My goodness, big difference. Big difference. Push up again. I cannot budge it.
So that doesn't that mean there's instability? Because one strong, one weak?
Right now what it means is there's a weak psoas. We know that. There's a weak psoas. Now we have to find out why, okay? Why there is. Now, I'm not glad that she has a weak psoas, but I'm kind of glad this showed up because this is where you start with lower back problems. You don't go start somewhere else. When you're building a house, you don't start by building the upstairs bathroom. You have to start by pouring the foundation. The psoas muscles are the foundation. That's why we always check these first. And if one is weak, there's no need to go on any further until we get that fixed. Does that make sense? Okay, so we've determined that Miss Melissa has a weak psoas muscle. Not good. Now, one of the things that happens, and one of the reasons people can get a psoas muscle that's not working great, is because of dehydration. This muscle is very prone to not working properly if you're not getting enough fluids. Now, what my patients will say, like, oh, Dr. Echols, I drink water all day long. I pee like a racehorse. It goes right through me. If that's the case, then you may not be getting enough minerals, because minerals are what actually pull the water into the cell. Without minerals, you can't pull the water into the cell. You need that in order to do that. I use a product called Organically Bound Minerals from Standard Process, and you can just take some of those every day, and it'll help pull that water in and actually get you hydrated. So that's one of the issues with that. There can be other things, and that's what we're going to do right now, is figure out why she has a weak psoas. And with any luck, hopefully we'll get it corrected today. Sound good? She's about to go to sleep on me. All right, so Miss Melissa, the way we find these problems is we use an indicator muscle like this one, and perfect. There you go. Are you a stranger to no, stranger to AK? So this is good. We're going to have her push here now. So we're just going to walk down here. Miss Melissa, I want you to open your eyes, close your eyes, leave your feet apart, okay? Don't let them get together. And we're just going to start finding out what kind of problems are causing this muscle to not work. Okay. Now, the first thing that shows up is what we call a neurolymphatic point. It's not really that important, except we know that in this case, it's about right here on your spine. I'm going to get in this psoas muscle with my elbow, kind of deep in here. And we've got some tissues over there if you need them, because this can be pretty, okay, yeah. She'll let you know when we've gone about as much as we can. This can be pretty uncomfortable, but we just kind of let the patient breathe through it. And she's doing a great job of that. And as she's breathing, I can actually feel the muscle, even though it's with my elbow. I can actually feel the muscle starting to kind of relax. And I am actually feeling for pulses here in her back, and also here in the psoas muscle. And when these pulses will synchronize, then I've done about all I can do with this particular part. If a psoas muscle is left untreated and unfixed, it can cause structural imbalances in the spine that can go on to cause further problems like herniated discs and misalignments in the spine and that kind of thing. So we definitely want to get it fixed and not let it continue on. And she is really doing good. She's doing her job here. We're going to gently kind of let off of that for a second. And then we're going to have you come back with me here. Push here. Good. All right. So now that we've addressed that, in her body, there's actually a misalignment in one of the vertebrae of the spine. It's the L1 vertebra in your spine. And we are going to get her, we're going to adjust that. We're going to have you roll over onto your side facing me. Now, this table is a lot taller than what I'm used to working on. And it makes it a little more difficult to do a really good adjustment up here, but we'll do the best we can. Okay, so we've located the L1 vertebra here, and I've got her leaned over here a little bit, and we're just going to put a little light pressure here. There it goes. Moved perfectly. Melissa, did you feel that? Awesome. Perfect. Keep these feet apart for me, and just put them down. Very good. Okay, so now there's been two components that have been needed to be addressed with this muscle. One was one of the acupressure points, the neurolymphatic points, coupled with the muscle. Now, the next point that showed up was actually one of the vertebrae itself. So let's see what else is left. The visceral organ reflex for that is going to be there, or, oh, that's the MAP. There we go. Okay, it's going to be right here. Yeah, still a little tender, isn't it? Oh, it's a lot tender.
Oh. It's okay, it just got really sharp right there. Mm-hmm.
She's really having some pain in this muscle, and these muscles are very, very painful when they get inflamed like this. But the good news, if they're fixed, they get pretty much fixed. We don't have to go through it again.
Is this still the psoas?
Mm-hmm.
Now with this muscle, because I had endometriosis,
Mm-hmm.
so I'm wondering if this was some of the pain. It's just
Very well could be. You know, some of that tissue can hook around to anything. And again, this is called the visceral organ reflex, and we are pulsing these two together. Just give the body a chance to normalize here. All right, and that's pulsing pretty good. So let's see where we're at now. Now she's showing that there's a nutritional aspect to this, and in this case, we might recommend that she acidify her body. We use a product called Food Liquid. It makes things a little more acidic, and it actually can help this muscle. But we don't have any of that right now. We're just going to kind of go around that for right now, and that's what the purpose of this little temporal tap is. Good. Okay. L4. So we have Melissa, we have another vertebra that's showing up in your spine. It's L4, and it's going to be on the same side. So I want you to roll over here, facing me. And this will look very similar to the last one that we did, except for it's another level. It's not the same vertebra. This one's a little bit lower down. Turn this, there we go. So this, now we have found that the psoas muscle is also related to our L4 vertebra. So we're just going to gently get in here and move that just like that. Boy, you do that good. Lay on your back for me. And now let's see where we're at. So in order to fix this muscle so far, we've had two different points that we had to pulse with the muscle. We've had the L1 vertebra that needed to be adjusted. We've had the L4 vertebra that needed to be adjusted. So a lot of times it's not just a real simple matter to fix these things. Push. Okay, turn here again. Okay, back to neutral. Okay, now when the body's arm here goes completely, this is what we call going into yin. It just means that there's weakness now where before there was strength. This is the body's way of telling me, okay, doc, you fixed the problem at this point. But I always like to check it out and verify it. So what we're going to do is we're going to retest that muscle. And we can find out whether it feels a lot stronger now, okay? So now push up for me real hard. It is rock solid. What do you think, Melissa?
Really cool.
Isn't that cool?
Really cool.
That's why I love this work. It's just so amazing because we don't have to wonder if you're better. We've got the proof right in front of us. That muscle is rock solid. Experienced, yeah, we know it's better. So we're going to tap this muscle, and if there's anything that we missed, it will kind of cause that muscle to go weak, and we'll retest it again. Push up for me, and it is, I would dare say that's 3 times stronger than it was when we first checked it out. This is going to give her back a lot more stability. So I want you to call me later and let me know if you're able to go longer without these intense yoga sessions, because that muscle's fixed. Now, you can do something to break it again, okay? But hopefully it'll just stay fixed, if you don't.
It's interesting you mentioned hydration because I got really dehydrated last week.
Yep, and that may have been it. It's very prone to dehydration, so minerals and water for you.
Minerals and water.
Now we're not quite done with this. We're gonna do one more little test, and this is a test for what we call strain counter strain, and it's important. So what you're gonna do is I'm gonna show you the position I want your leg in. I want it like this, but I want you to do that without using your hands. Pull it up and over and just hold it there, kind of pulling that muscle up for a minute. So I'm challenging this muscle. I'm putting it under strain to see if it's actually going to hold up. Okay, now back again and push up for me real hard. And it does. So we don't have to do anything more with this. But let's say that she did that and boom, it went out again. We would do another technique called strain counter strain, and it's just a miracle technique. But I'm not really going to go into it today. Maybe that'd be for another video. But once we do that, then it's fixed and it should stay fixed. Okay, Melissa, how are you doing?
Oh, so much better.
All right, I'm so glad to know that. So what we've done is we've actually started working on her lower back. We found that the psoas muscle was just not really firing, not working properly. We found several misalignments in her spine, several other muscles that needed to be worked on. Now when we tested the muscle, it's rock solid. And I have to tell you, this is one of the reasons I love applied kinesiology so much. We don't have to wait to know whether this lady is better. We know she's better right now before she even leaves the office, because she could barely hold her leg up before, and now she can almost throw me through the ceiling with that leg. So it's a good point to know that when you find a weak muscle, it's not because it's out of condition. You don't need to go exercise the muscle. You just need to get it reconnected to the source, the power, which we just did. So I'm going to leave off with this. Please join us on the next video where we will continue to work on her back and see what other trouble areas we can find and see what other more we can do to help her. Thank you so much for watching. Keep the keep the phone calls and the emails coming, and if we can help you, please let us know. Thanks.